Good morning. My name is Terry Lee Bivona. I'm a 52-year-old hospice nurse of about 12 years, and recently got diagnosed with profound bone and prostate cancer stage 4, and I actually have become a hospice patient. And I want to use this opportunity on these video clips to share fantastic experiences that I've had of patients and their interaction with me and me with them that show us different sides of reality and love. So this one is called The Vowel, like the letter V. I was working in home IV care at one point, and people had antibiotics at home, other IV medicines, and they were on them for long periods of time, for weeks or months. And so this story goes, I got called from one of the other nurses who was about 30 miles away from me. He and I did not know where each other were located in a 50-mile radius of this city. So he called me and said, where you at? I said, why? He says, I got this guy off of Route 153 and was wondering if you could see him. I'm just on the other side of the city and I'm not going to be able to get there. As he was saying that, again, we have a 50-mile radius, which means 100 miles across this town area. As I look up, I am at Route 153. And so we laugh about that. It's like perfect. And the man ends up being only 1 mile from this intersection. So obviously the right place to be at the right time. So I go to this man's house, and he is a tiny little old man. He has a tiny little old house, and his dear wife is there with him. And it's very sweet, and he talks like this. He's like, how are you doing? What's going on? This dear, dear voice coming out of this little old man. And one of those things, you just can kind of fall in love with people instantly. So as I came into his house and got greeted in this very dear way, one, by adding him to my schedule of things to do, it made things kind of hurry a little bit. So I was kind of quickly changing the medicine cassette, quickly checking his vital signs and all. And so as I was doing these things, his blood pressure was about 210 over 180. And I looked at him kind of alarmed, and he says, well, now that's starting to make some sense. And I said, well, why is that? He says, I've had a headache all night. I said, well, yeah, that makes sense to me too. He says, yeah, he says, it's usually not that low. That low. Turns out this guy's a blood pressure literally like 260 over 120, and in that range he actually doesn't get a headache. So obviously severe cardiac disease, heart disease, really profoundly high stroke risk, blood pressure. So I'm learning a lot about this little man really quickly. And so we talk about that because I certainly expected his blood pressure was too high, causing the headaches, and for him too low. So this very dear man, not well educated from an academic point of view, a country fellow. He actually kind of worked in his community, like cleaning up community projects. He helped in very simple ways for a very modest income, and his wife, I think, was actually the breadwinner. Other part of the story is this man was about 73 years old. So this kind of endearing beginning like this, and so as he's sitting there, he's trying to kind of connect to me in a professional kind of way. Then I said, so how else is it going today? And he says, well, it's going good. He says, you know, and he kind of leaned into me and dropped his voice a little quieter. He says, you know, I had me a vowel movement this morning. And I kind of looked down because I heard a V at the beginning of that. And I looked down and he was really serious. He says, you know, a vowel movement. And it dawned on me that for his years and kind of his socioeconomic status, he was hearing it the best that he could. And not a bowel movement like with the letter B, but a vowel movement. He was so earnest, and he knew that he was telling me a right medical terminology and that he was nailing it. That the best I could do was to put my little grin away and just really straight out go, that's good. That's a really good way to start the day. And he says, oh yeah, you know it is. You know it is. So it was so endearing, this little man, this little vowel movement. And so I just played with that imagery in my head that it was just the sweetest thing. So getting things done with his IV and his cassette and all, and he was eating some dried cereal that he just really didn't look happy with, and lots of medications and complex things, and I could tell him and his wife just weren't happy. And he says, can I ask you something? Of course, the answer was yes. He says, I got like 3 or 4 doctors, and they're always telling me something different, and what one says, the other says, the opposite. He says, what should I do? And I looked down, I thought a minute, I listened to my own inner guidance, and I said, well, I said the idea of doctors, nurses, even just like people who work on your car, your house, they're advisors. And they take the information that they have and the view that they have, and they're going to present to you what to them seems like the smartest thing to do. A lot of times they'll present 1 or 2 or 3 options. But their intent really isn't to control you. Their intent is to, in their meaning, is to give you the best idea that they can. But you still have to take that idea home and kind of work that out yourself. A lot of them do want you to do exactly as they say, and there's some risks medically if you don't. But that's really what their role is to advise you, especially when you've got multiple healthcare people telling you different perspectives, perhaps even of the same thing. So that it all comes back to you and the decisions that you make for the quality of life that you want, or your understanding of what's going to be in your best interest. He says, okay. He says, my wife is my doctor. I can't eat nothing that I like. He says, I like bacon, I like eggs, I like my sausage, and I can't eat nothing with cholesterol in it. And he says, I'm just not so happy. He said, my wife had been cooking for me since we was young, and now she can't cook nothing for me, and nothing tastes good that she cooks because it's nothing that's got any taste. He was just so sweet, this man just pouring out to me like this. And as I watched her in the kitchen, I really could feel that part of their intimacy was in having meals together, in her honor of being a wife and cooking for her dear man, which he certainly was. And she turned around in the kitchen and a little apron on and all these things, but it really was a lackluster meal preparation, again with dried cereal and I think toast without butter. It wasn't appealing. So I repeated this thing about them kind of needing to figure out their own values and what really makes sense to them. And so he really pondered that with his wife. He says, okay, well, I'll think about what I should do. We'll talk. Okay, so I had to come back actually 2 days later. That was a Friday, and then I was on call that weekend, so I came back on Sunday. And his house off of that road 153, again 1 mile, so got down about 3/4 of a mile off of 153 and then take a right. So I do this on Sunday to see him again to change this medicine cassette. As I'm coming to his house, it's very cold morning, very frosty, and above his tiny little house is a tiny little cloud. Only over his house, from his kitchen, flew. I roll down my window and I smell bacon. I smell eggs and I roll my eyes. I'm like, what have I done? What have I done? Then I pull down into his driveway and the road's high and then the house is kind of down off of that. And I come to the house and all I can smell are these high cholesterol, high anti-cardiac food aromas, literally in this little cloud over this tiny little house. Only this house at 5:30 in the morning. I knock on the door and he yells, "Come in!" And I open this door, and if it was physically more dense, I would have probably been pushed out the door like the Michelin man of food aromas, pushing me back out the door with the smells of all of this stuff. Real butter, real toast, eggs, bacon, and sausage. And the crackling sounds, because this is from the old days of cooking where all the grease stays in, and when you make the bacon and eggs and you throw the eggs in last and you get the egg crackly sound, and it was just hilarious and horrifying all at the same time. I just was like, what have I done? He says, me and my wife, we thought about this. And he says, I would rather live a shorter life and be happy than to live a long life. He says, I'm already 83, something like that. And he says, so we made a decision last night, we're going to eat happy. And then that great, eat happy. And so I had to find some way to document that I had reviewed with him and his wife their decision making, and that the doctor's input really did matter. But if this was an agreement they made and it fit their value system, then that would just be documented that way, and that's how I ended up doing that, because it certainly was a change in lifestyle. So what ended up happening, the primary nurse picked back up the case the following week, and I didn't see the man again. And about 6 months later, I ended up back on 153, Highway 153, and on that little corner within that mile is a little community grocery store. And as I turned the corner, I saw this man's wife. And she looked at me, and even from the road, she recognized me, and she gives this really big wave. And then I pulled off the side of the road, and she came up and greeted me. And we'll call him Sam. And Sam had passed, and she says, "Did you know that Sam passed?" And I said, She says, "Yeah, he died probably about 4 months after you were there." And I said, I said, "Did he have a peaceful death?" She says, "Actually, it was a beautiful death. He died real quiet. He didn't have any pain or anything." She says, "I just want to thank you." I was like, "Okay." And she said, "When you talked to Sam about making the choices and the doctors were just trying to be advisors and help," she says, "he needed that." She says, "I needed that." She says, "We were going crazy. Every doctor had a different point of view on some things, and half of the stuff were like opposite. And we didn't know what to do with that, and it was really hard for us. But when you said for us to look at it from what we're trying to get out of life," she said, "that really made a big difference to us." And again, Sam's old, and he's lived a good life, and so have I. And for him and I to really decide that we wanted to eat happy really made a difference. And he even knew, because we both said, life could be shorter with this, and they said, "But it'd be better." And she said that really made a difference, because I got to cook for Sam again, and I hadn't done that in years. And she said that's how we met, and that was a really nice thing in our relationship that kept us close, was eating together, cooking together, and eating things that we both really, really liked. So she says, yeah, maybe he died sooner, but he died really happy. And she said, and you helped make that happen. So I just really want to thank you for taking the time to help us talk that through. And so that was kind of the point of the story, is so many times all of us in our best sense from the outside have our own impression or decision tree or algorithm or way of that we're pretty sure other people would have a better life, but the better is actually defined by them. And this turned out to be the intimacy with his wife and the relationship of cooking and being in the kitchen and sharing all of that togetherness. And it turned out to be a really beautiful thing, a shorter life in his 80s, and he died happy. And that's how his wife remembers that, and she got to give him love through their cooking. So they taught me how to eat happy. Thank you.